Hello and welcome. Today, we're going to talk about something that a lot of women go through, but that often isn't discussed very openly. We're going to break down what rectoceles and enteroceles are in simple terms so you can have a much clearer picture of what might be going on inside your body.
So let me ask you, does any of this sound familiar? Maybe a feeling of pressure down there, or you can actually feel a bulge. Or maybe it's that really frustrating feeling that you can't quite empty your bowels completely. You know, these are super common symptoms, and they're definitely worth paying attention to.
If you're nodding along right now, the most important thing I want you to hear is this. You are so not alone. It's a fact that up to half of all women who've had children will experience some kind of pelvic organ prolapse. It's incredibly common. So let's dive into what's actually happening.
Okay, so what's really going on down there? Well, we're going to focus on two conditions today, rectocele and enterocele. They sound a little alike, I know, but they're actually two different things happening in the same, well, neighborhood of your body.
First, let's talk about a rectocele. The easiest way to think about this is to picture the wall that separates your rectum from your vagina. A rectocele happens when that wall gets weak or stretched, and it allows the rectum to bulge forward right into the vagina.
Now, an enterocele is a little different. With this, it's not the rectum bulging forward. Instead, it's the small intestine, which is normally higher up, that starts to push down into that space between the rectum and vagina. It's basically a type of internal hernia.
This chart makes the difference really clear, doesn't it? For a rectocele, the problem is the rectum pushing forward. Think of it as a problem from the side. But with an enterocele, the issue is coming from above, with the small bowel dropping down. Side versus top. That's the simplest way to remember it.
Okay, now here is a really surprising fact. Did you know that small rectoceles can be found in up to 93% of women who have absolutely no symptoms at all? This is so important. It tells us that just having a rectocele on a scan doesn't automatically mean it's a problem. What really truly matters is how you feel and what symptoms you're having.
So if it's all about the symptoms, how do doctors get a good look at what's causing them? That brings us to diagnosis. The goal here is to get a clear, moving picture of what's happening when you're actually going to the bathroom. You see, your doctor really needs to see your pelvic floor in action to figure out the mechanics of what's going on. A physical exam is always the first step, but to see the whole story, there's a special imaging test that's often considered the gold standard. This test is called a defecography. Now, I know it sounds a little intimidating, but it's actually a pretty straightforward process. First, a technician will gently place a thick paste in your rectum. It's designed to feel like stool. Then, in a completely private setting, you'll sit on a special toilet while a live X-ray video records what happens as you have a bowel movement.
And wow, this test shows so much useful information. It can measure the exact size of a rectocele, and this is the important part, see if it's actually trapping stool. That's what often causes that incomplete feeling. It can also spot an enterocele and see how well all your pelvic floor muscles are working together. It basically gives your doctor a complete roadmap for what to do next.
All right, once you've got that clear diagnosis, you and your doctor can start talking about relief. And for many women with really bothersome symptoms, surgery is a fantastic option to get things working right again and just improve your day-to-day life.
Now, it's really important to get this. Surgery is almost always recommended based on your symptoms, not just what a scan shows. For instance, a really significant symptom is if you find yourself needing to press on the back wall of your vagina with your fingers just to be able to have a bowel movement. If your life is being disrupted like that, then it's definitely time to discuss a surgical repair.
For a rectocele, there are a few common ways to fix it. The repair can be done through the vagina, through the rectum, or through the perineum. That's that small patch of skin between the vagina and the anus. Your surgeon will talk with you about which approach makes the most sense for your body.
But no matter which way they go in, the goal is always the same, to strengthen and reinforce that weakened wall between the rectum and vagina. The surgeon carefully stitches your own supportive tissues back together to get rid of that bulge. And in most cases, they use your body's own tissue to do it. Now, for an enterocele, it's a different game plan because remember, the problem is coming from above. A very common and successful surgery is called the sacrocolpopexy. This procedure actually lifts the pelvic organs back up where they belong and secures them, often with a small piece of surgical mesh. This can be a real team effort, sometimes involving both a colorectal surgeon and a urogynecologist working together.
So, now that you're armed with all this information, we get to the most important part of this whole journey, teaming up with your doctor to make a plan that is perfect for you.
I want you to remember that you are the most valuable player on your own healthcare team. And asking questions, that's your superpower. It's how you make sure you understand everything and can make a decision you feel really good about. So, what should you be asking?
Here's a little conversation starter kit for you. Don't be shy. Ask your doctor which repair they recommend, and more importantly, why they think it's the best one for you. Talk about the risks and the benefits. Ask them to paint a picture of what recovery will look like. And it's always a great idea to ask if there are any non-surgical things you should try first. But maybe the most important question is, will this surgery fix the specific problems that are bothering me the most?
You know, dealing with pelvic floor issues can feel really isolating and confusing. But just by watching this, you've taken the first and most powerful step toward taking back control. Understanding what's happening in your body is everything. The path to relief really does start right here, and now you're ready to work with your doctor to find the best solution to get you back to feeling like yourself again.